Well, so fixed braces are the most common type of braces that have been used for over easily hundreds of years, and mostly in their current version in the past about 100 years. They have two main types based on their material. One is a clear brace, which is a teeth colored one, and the other one would be a metal brace, which most of us have seen numerous times, and that brace would be the one that most teenagers would get. But here in our practice we most often work with the teeth colored ones because they are more aesthetically pleasing. Braces can be placed on the outside and the inside of the teeth, but the ones on the inside of teeth are a bit more uncomfortable to have and a lot more difficult for us to service, so as well as they're more expensive. So we tend to use the ones that are on the outside of teeth because they work quicker and they are more versatile. So with fixed braces, we tend to, as with all of our treatments here, we first would invite our patients to book a free consultation, which would help us understand their needs, their concerns, and how we could be of help to them. That would help us give them an initial idea of our suggested options. Then normally a few weeks later we would invite them to come back for a full assessment, which would include x-rays, photographs, and a full checkup. That would help us figure out where we're standing and if we can be able to start treatment straight away, or if we need to look into just cleaning up a few fillings or seeing the hygienist as well. Afterwards, as I just mentioned, we would book them in with the hygienist, and a couple of weeks later we would have normally an appointment which is called a smile design, and we would demonstrate how the fixed brace should alter their teeth and help us achieve the smile that they want. Afterwards, normally between 10 days and 14 days later, we would be ready to fit the fixed brace, and that's when we would have a bit more extensive appointment, which would help us place the brace, make sure everything's secure in place, give our patients some advice on how to look after the brace, and that would take us to the point where everything's ready to be in use. And normally about every 4 to 10 weeks after that, we would have regular appointments every 4 to 10 weeks, and then we would be able to look at tightening the brace, changing some brackets, changing the wires, and just making sure the progress is going correctly. Once that all is done, we would normally have our final checks and look at taking the brace off. Have another appointment with the hygienist, which would help the patient have their teeth cleaned and polished. Make sure that we are happy with the results, and sometimes, not always, we would look at using removable braces as well to just finalize that treatment with fine tweaks. That's normally included in the cost, and it's just for a few weeks. And once that's done, we would look at retainers, which would be either fixed or removable retainers, or both. Some teeth whitening, and the option to continue coming here for regular visits to check and make sure everything stays the same throughout their lifetime. Treatments with fixed braces normally take between about 6 months and up to about 18 months. I would say that on an average it's 6 to 12. The costs with fixed braces are a bit more predictable than the ones with removable braces, because once we know the needs of the patient and roughly how complex the treatment would be, we normally would look at about 1,600 to about 2,400-500 for a single jaw. That would be upper or lower. And most often with both jaws worked on at the same time, we look at somewhere in between 2,600-700 to about 3,500, but normally not more than that. Fixed braces are a brace which is very effective. It's oftentimes a bit quicker to work than removable braces are, because they are fixed on our teeth 24/7, and we don't have the choice of removing them, which to some people might seem like a bit of a limitation, but actually it normally cuts the amount of time you spend in your treatment. They used to be perceived as something that is quite visible and intrusive, but actually with the more cosmetic options now, more cosmetically appealing options now, which are the clear teeth colored brackets, they can be kept quite unintrusive if we make some corrections to, or minimal changes to our diet, and we do well with our cleaning. And one of the biggest benefits is that they can help widen the smile of our patients a bit more extensively than sometimes removable braces can. And they are a bit more suitable for slightly more complex movements than removable braces or aligners would be. So with fixed braces, patients coming here normally would express their concerns with regards to the fact that they've been always afraid to smile, and they would be unhappy to show their smile in photographs or in front of their friends and family. And when they are considering fixed brace, they would always worry about how that brace would make them look. Would they be able to keep it clean, and would it affect their speech actually? We've had quite a few patients here who work in the public sector, and they will be concerned with regards to changes to their speech, but actually fixed braces affect that very minimal. With regards to appearance, because we use normally clear fixed brace, which is teeth colored or close to transparent, when it's kept clean and if our diet is kept without having any very saturated colored foods and drinks, normally they remain quite discreet. And the biggest concern patients have with regards to throughout treatment with having foods and keeping everything clean, that's really something that you really easily get used to once you get into it. Obviously once everything's done and you are persistent with keeping everything nice and clean and the brace comes off afterwards, normally that's the most rewarding part of the experience, when it's the big unveil of the smile, and normally patients are quite surprised by the change, especially in the width of their smile, and how the smile would look much brighter once the teeth are whitened as well.